condition that develops in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. The primary cause of cervical cancer is the human papillomavirus, or HPV, a common sexually transmitted infection. Unfortunately, many women are diagnosed at later stages of the disease due to a lack of awareness about the early warning signs. By understanding the symptoms, women can seek early medical intervention, which greatly improves the chances of successful treatment. In this video, we'll explore the 10 major warning signs of cervical cancer. The first and most common warning sign of cervical cancer is unexplained vaginal bleeding. This type of bleeding can show up in different ways. Some women experience bleeding between their regular menstrual cycles, which is unusual and should raise concerns. Others may notice bleeding after going through menopause, a time when they should no longer be experiencing periods. Any postmenopausal bleeding is a red flag. Some women also report bleeding after sexual intercourse, which can be alarming. This happens because the cancer may cause irritation or ulceration on the cervix, leading to unexpected bleeding. If you ever notice unexplained bleeding, it is important to consult a healthcare provider immediately. The second warning sign is unusual vaginal discharge. This discharge may appear watery, foul-smelling, or even mixed with blood. It can also vary in color, ranging from clear to brown, or even pinkish if there's blood present. While vaginal discharge is a common occurrence for many women and abnormal, persistent change in the nature of your discharge could signal a problem. This could be due to cancerous cells irritating the cervix or other reproductive tissues. Next, there's pelvic pain. While it's common for women to experience pelvic pain related to menstruation, pain that occurs outside of your menstrual cycle is worth paying attention to. This pain can feel like a dull ache, or it can be sharp and intense. Sometimes, it is more noticeable during certain activities, such as sexual intercourse, urination, or bowel movements. Because the cervix is located in the pelvic area, a growing tumor can press against nearby organs and tissues, leading to this type of discomfort. Speaking of sexual intercourse, another warning sign of cervical cancer is pain during sex. This type of pain is known medically as dyspareunia. Painful intercourse can occur if cancerous cells are spreading and causing irritation to the cervix and surrounding tissues. If you experience ongoing pain during sex, particularly if it's new or accompanied by other symptoms like unusual bleeding, it's essential to get checked by a doctor. Sudden, unexplained weight loss is another concerning sign. When cancer is present in the body, it often causes the body to use more energy than usual, which can result in unexpected weight loss. You may notice that you're dropping pounds without any significant changes to your diet or exercise routine. Additionally, cancer can interfere with your body's ability to absorb nutrients properly, which also contributes to weight loss. If you notice rapid, unexplained weight loss, it's worth investigating further. Fatigue is another common symptom. Cancer cells consume a lot of energy, leaving the body feeling drained. In the case of cervical cancer, this can be worsened by anemia, which is a condition where there aren't enough red blood cells to carry oxygen to the tissues. This can happen if there is significant or prolonged vaginal bleeding. Fatigue that doesn't seem to improve with rest, or that persists over time, is a signal that something may be wrong. It's a general sign that many cancers share, but one that should never be ignored. Frequent urinary problems can also point to cervical cancer. The cervix is located near the bladder, and as the cancer progresses, it can put pressure on the urinary system, leading to issues. You might notice that you have to urinate more frequently, even though there's not much urine produced. This could be a sign of a problem with the bladder. Painful urination is another red flag, as is blood in the urine. These symptoms often go unnoticed because they can be mistaken for common issues like urinary tract infections, but they can also be indicative of cervical cancer when paired with other symptoms. Another sign that may be more surprising is leg pain or swelling. As cervical cancer advances, it can block blood vessels or lymph nodes in the pelvic area, causing a buildup of fluid in the legs. This often results in pain or swelling, typically affecting one leg more than the other. You may feel a heaviness or aching in your leg, which can become more pronounced over time. This symptom usually indicates more advanced cancer, so it's important to get evaluated if you notice this kind of swelling or pain, particularly if it's persistent. Lower back pain is another symptom to be aware of. Like pelvic pain, This can be caused by the tumor pressing on nerves or tissues in the pelvic region. Women might feel a dull ache in their lower back, or it could manifest as sharper, more intense pain. Since back pain is common for a variety of reasons, many people don't immediately associate it with cervical cancer. However, when it persists or occurs with other symptoms, it should not be overlooked. Finally, changes in bowel habits can also be a sign of cervical cancer. This might manifest as constipation or diarrhea that lasts longer than normal. Some women may notice rectal bleeding, especially if the cancer has spread to nearby organs like the rectum. Since the cervix is located near the intestines, a growing tumor can put pressure on the bowel, causing these changes. If you notice persistent changes in your bowel habits, it's worth seeking medical advice, especially when combined with other symptoms. Now that we've discussed the 10 warning signs of cervical cancer, it's essential to understand that early detection plays a crucial role in successful treatment. The human papillomavirus, or HPV, is the leading cause of cervical cancer, but the good news is that it's preventable. One of the most effective ways to reduce your risk is through the HPV vaccine. This vaccine is recommended for both boys and girls, and it's most effective when administered at a young age before individuals become sexually active. Since HPV is a sexually transmitted infection, the vaccine can greatly reduce the likelihood of developing cervical cancer later in life. Regular Pap smear tests are also vital for early detection. A Pap smear can detect abnormal or precancerous cells in the cervix before they turn into cancer. Women are advised to start getting Pap smears in their early 20s and continue with regular screenings as recommended by their healthcare provider. Depending on individual risk factors, some women may need more frequent testing or additional screening through HPV testing. Combining these two tests provides a comprehensive approach to monitoring cervical health. For those who smoke, quitting can also lower your risk. Smoking weakens the immune system and makes it harder for the body to fight off infections, including HPV. It also exposes the body to harmful chemicals that can damage cells and increase the likelihood of cancerous changes. Quitting smoking not only reduces the risk of cervical cancer, but also improves overall health. If you experience any of the symptoms we've discussed, it's important to seek medical advice promptly. Early detection can make a significant difference in the success of treatment, as cervical cancer is often highly treatable when caught in its early stages. By staying informed, keeping up with regular screenings, and taking preventive measures, you can significantly reduce your risk of cervical cancer. Encourage the women in your life to stay on top of their health, as education and awareness are essential steps toward prevention and early detection.